It's not just flu, unfortunately. Another virus called, we'll just abbreviate it, RSV, stands for respiratory syncytial virus. I don't think you need to remember that. If you do just RSV, you'll be okay. So this is a virus that in most of us causes mild colds. A little bit of a runny nose, stuffy nose, maybe a bit of a sore throat, maybe a bit of a cough. And then it goes away in 4 to 5 days. But in the little tiny kids, so children particularly under the age of 1, RSV can be a very serious infection. And the reason why it's so serious in kids under 1 is this virus affects mostly our airways, those tubes that come from the back of our throat down into the lung and branch out to all the different parts of the lungs. So those tubes in us adults, when we get it, they're big enough and the inflammation doesn't really compromise the size of the tube. But the little tiny babies, they have very, very small tubes. And so if they get inflammation from that virus, those tubes get narrow. And it makes it harder for the baby to breathe, and then they get pneumonia. And then they end up in the hospital. And RSV is a significant cause of hospitalization for young children, those under the age of 2 or so, usually during the winter months. But this year we're seeing it now. And we're also seeing a lot more other cold viruses going around. I won't go through all of the names, but it's cold and flu season now. So why is that the case? Well, it's kind of interesting. Throughout COVID, we've seen disruptions in how our usual cold and flu viruses transmit. Usually when COVID dominates, the other viruses are they lay low. They don't like the competition, I guess. And so we haven't seen as much of these other viruses over the last 2 to 3 years. Usually with a lot of these types of cold and flu viruses, getting infected periodically over time, every year, maybe every other year you get a cold, and it increases your immunity, beefs it up a little bit, tops off your tank immunologically, and that keeps you from getting more serious infections. And we haven't had that over the last couple, 3 years. So these viruses are taking advantage, I think, of a reduced population-based immunity to RSV and such.